Hi, I'm Easterly.
I'm Emma Edson.
Hi, I'm Emma Traybold, and this is our presentation on reactive attachment disorder. What is this condition and what causes it? Reactive attachment disorder is an uncommon but harmful development shown in younger children. Children with RAD struggle to develop appropriate emotional attachments with their primary caregivers. Children with RAD often connect in concerning ways with others, which can then lead to poor social skills and behavioral issues. When upset, children with RAD behave in an introverted and unattached manner and don't respond to comfort. RAD can be caused by a number of factors such as neglect, abuse, separation from the primary caregivers, or frequent changes in caregivers. When a child's basic emotional and physical requirements for excitement, comfort, and love are not satisfied during the crucial early developmental stage, which starts and ends around the age of 5, the disease develops and normal attachment processes are disrupted. Frequency. RAD is more common in kids who are in foster care or live in places like orphanages where it affects about 1 to 6% of them. So it's rare to see them in a normal two-parent household. There is little data to support the idea that sex or race significantly affects the occurrence of RAD. However, the risk is greatly increased by environmental factors such as extended institutionalization, repeated foster care placements, or exposed to severe abuse and neglect. Although RAD is not common in most kids, the behavioral signs may differ significantly with boys, exhibiting more externalizing tendencies. Boys and girls seem to be equally impacted, but for kids missing these factors, it's much rarer.
I'm Emma Edson, and I'm going to be starting off by saying how RAD is identified and diagnosed. Reactive attachment disorder is identified by observing consistent patterns of emotionally withdrawn behavior toward caregivers. Some of these observable behaviors include not smiling, avoiding eye contact, not reaching out for comfort when upset, and showing little to no emotional response to caregivers. To diagnose, a healthcare provider might ask a series of questions, which can include: has your child experienced any abuse or neglect? When did you first notice symptoms? How do you and your child interact? What is your living situation? Are there other caregivers your child interacts with? The healthcare provider also may want to do other tests to rule out other reasons for their behavior, such as autism. Impact on communication. Children diagnosed with reactive attachment disorder are often resistant to expressing their emotions and strive to be independent of others, which is why communicating can be challenging with a RAD child. This can be due to several factors. Some of these factors include limited expressive language. For example, if a child is hungry, instead of expressing that they're hungry, they may just act out. They also have difficulty understanding social cues. If a caregiver is trying to joke with them, they may not pick up on this and also act out. And if the condition is really bad, they may avoid verbal interaction altogether.
Hi, my name is Kai Easterly, and now we're going to talk about how RAD impacts children's behavior. Now, children that experience RAD may show emotionally withdrawn behavior. This could include when someone comes to them and is crying or upset, they might just kind of turn away and not really do much and just look at the floor. Another thing is when they're upset, they have a really hard time going to people and explaining why they're upset. They don't really know why they're upset. They just know they're upset or they're overwhelmed or they're angry. Now, children might also experience an absence of social and emotional responses to others. Like I was talking about, if they see someone crying, they might be like, okay, why are you crying? And not really think too much about it or know what to do. They might also respond to normal interactions with aggression, fear, even defiance, because they're not really used to the whole normal interactions dynamic. They can also be unpredictable, difficult to discipline and console. Like I said, when they're upset, sometimes they want to be alone, or sometimes they'll run or try to do anything when they don't know like why they're upset. And then they also live in fight, flight, or freeze, which is another reason that they might experience this kind of behavior and have these responses. Now, we also want to look at the red flags for RADs for the children's behavior. They might have the inability to learn from mistakes, impulsive behavior, such as feeling overwhelmed in school and not really know why. And instead of explaining that they're overwhelmed, they will run out of the school. And a firsthand account of this that I saw was this boy who's just, he knew he had to get out of school and he ran about 1 or 2 miles before someone caught him and he was able to calm down and understand like what was going on. They can also have abnormal speech patterns, learning problems or delays, disruptive behavior, such as destroying objects or hurting themselves, and self-soothing behavior, such as rocking back and forth. Now, the recommendations that I would give to SLPs when working with children that are experiencing RAD is only to use positive reinforcement. Now, this should be done by adding a stimulus and setting small, achievable goals. This will also build trust between the SLP and the child that has RAD. We want to build a nice baseline for them to trust you before we want them to do any really hard tasks. And you also want to be specific when you're praising a behavior. You want them to know what you are praising and what behavior you want to see more of. You're going to try to avoid taking items from the child because they're kind of used to not having things due to the trauma or experience that they might have. You don't want to be taking anything from them, and you want to have a consistent environment. You don't want to be rearranging a room every time they come in or changing everything up. You want it to be pretty consistent. Now, this is our works cited, and thank you so much for listening to our presentation. And if you have any questions in class, please feel free to let us know and you can ask.